Hi all, I'm Shobana Rajaramon, pursuing my PhD in Quorum Sensing Lab at SASTRA Deemed University under the supervision of Professor Adline Princy, Associate Dean Research. Here I am to present a glimpse of my thesis title, CathGuard, Innovative Solution to Prevent Complications in Long-Term Urinary Catheterization. So healthcare-associated infections are of a great concern across the globe. So healthcare-associated infections include CLEP-C, catheter-associated UTI, ventilator-associated pneumonia, sensical site infections. Statistically, urinary tract infections account for about 34%, and in terms of healthcare-associated infections, it is catheter-associated urinary tract infections that play a major role. It is caused due to the placement of indwelling catheters in patients. It contributes to about 40% of 80% of 40% HAIs, and it makes up about 1/3 of device-associated infections. And specifically, antimicrobial catheter market is projected to grow to a rate of USD 2.41 billion in the year 2032. And what causes these catheter-associated urinary tract infections are various pathogens. And pathogen of our interest was Staphylococcus aureus. So basically, Staphylococcus aureus is a commensal in nature, but it turns into a pathogen when it gets its suitable environment. It is an independent colonizer, but ultimately it leads to evasion of host immune systems and helps in the colonization of other pathogens. It forms biofilms on urinary catheters, attaches to the urinary bladder tissues, and also passes through the urinary tract, leading to bacteriuria, bacteremia, urosepsis, and ultimately death of a patient. Of course, there are solutions to prevent catheter-associated urinary tract infections, which include antimicrobial catheters that is coated with silver. But the cause or the concern is the silver emergence of silver resistance. So to overcome this silver resistance, we wanted to come up with a molecule that could be a Lego molecule, structurally diverse in nature and had unique modes of action and multiple modes of action to prevent the gain of resistance. And one such molecule that could fulfill these criteria are metal complexes. And when we look into the periodic table, metal complexes or various metals are found, and one of the metals that could be of our interest was transition metals. And among the transition metals, palladium based metal complexes was our high interest, because palladium based metal complexes have proven antibacterial and antibiofilm activity across the literatures. So coming up with series of metal complexes, we screened about 12 to 14 metal complexes, and among that, QSLPD4A inhibited the formation of biofilm at a very low concentration. It reduced EPS, it did not have ROS effect, and also it did not exhibit cytotoxicity to kidney epithelial cells. So following this, we wanted to validate in human artificial urine media. So against varying pathogens, that is Staphylococcus aureus, uropathogenic E. coli, Proteus mirabilis. And it also exhibited activity against all the pathogens and downregulated the virulence, that is motility virulence of the pathogens as well, which helps in the colonization in across the kidney tissues and leading to urolithiasis. With this promising data, we moved ahead to translate it by coating it on the urinary catheter. We followed the method of impregnation by immersing it in chloroform or DCM solution, and visually it was confirmed with yellow color. And further, we wanted to characterize it to check the coating, confirm the coating, and with that we went for drug release kinetics in PBS 7.4, and initially it showed an burst release followed by sustained release over day 7. And in terms of in vitro validation, we validated in artificial urine media against E. coli, S. aureus, and Proteus mirabilis. Until day 11, it showed a good antibacterial and antibiofilm efficacy, and did not allow the adherence of bacteria to the surface. So following that, we wanted to validate in preclinical model, where we used rat model to validate the coated catheters against the pristine catheters available in the market. Significant biofilm reduction and viable bacterial count was seen in comparison with the pristine catheter available in the market. And also until day 9, it did not allow the colonization of bacteria. And in the bladder tissues, we could identify that pristine catheter placed animals had mononuclear infiltrates, wherein coated catheter placed placed tissues did not have mononuclear infiltrates, and there was no inflammation formed. With this, we could come to a conclusion: this palladium-coated urinary catheter had strong efficacy to prevent the colonization and bacterial adherence onto the catheters. And so with this, we've completed TRL level 6, and we have to obtain clinical and regulatory approvals before commercialization. And before commercialization, we have a future roadmap to improvise the efficacy of this coated catheter by changing the coating methods, and also validate it against polymicrobial environment, and go for combinatorial approach to reduce the concentration of metal complex, and also validate it in larger animal models for longer duration. And if this could be commercialized, the patients who would be benefited include patients with nerve and cerebrovascular damages, multiple sclerosis, patients with diabetes and orthopedic disorder, and patients with age-related health issues. And this work could not have been possible without our team at QSL and my professor, Professor Adline Princy, thank you for her immense support and motivation throughout this journey. And I would always be grateful to her for her insightful discussions and the ideas that she has been always giving me. I would like to thank the scholars of QSL for their support throughout this journey, and the project students of QSL. I would like to thank our collaborator, Dr. D. Suresh and Dr. Adlin, for providing us with the metal complex and helping us with the chemistry portion of the study. And I would like to thank the scholars of the Organometallic Lab. I would like to thank the funding agencies, Professor T.R.R. Rajagopalan in-house startup grant and the DST Nidhi Prayas for helping us carry out this work. Thank you.